Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, can a person with a personality disorder be a counselor? Now, I've received this question a number of times, and a lot of times the question contains a specific personality disorder. Like, can someone with borderline personality disorder be a counselor, for example? But I have seen it with all the personality disorders and mental disorders in general, the same question. This is a difficult question to answer because personality features are measured on a continuum, and I've really struggled with this particular video. This is the third time that I've recorded this. I recorded this twice over a year ago. I recorded it one time, and then I think it was a few weeks later I tried again, and I just didn't feel like I got it right. So today, for whatever reason, I guess I have the mindset where I think I can answer this question a little better. I don't know, so I decided to give it a try. So, as I mentioned, personality features are on a continuum. But the way we look at mental disorders, we look at those categorically, right? So they're defined by meeting X of Y symptom criteria, right? So, for example, with borderline personality disorder, somebody needs to have 5 of the 9 symptoms listed in the symptom criteria. So someone either has the personality disorder or they don't. But in real life, of course, we know, again, it's all on a continuum. So somebody can have borderline personality features but not technically have the disorder. Or somebody could have the disorder and they're never diagnosed. So they don't know they have the disorder. And when they attempt to enter the field, people would not necessarily know they have the disorder either. So there's a lot of issues around the diagnostic criteria and kind of how we look at disorders. Somebody having one or not having one or being somewhere in between. So either way, this is a fair question, right? We should be able to ask this question and provide some sort of answer for this question. But before I get into the answer, we do have to look at each of these circumstances case by case. I'll give my thoughts on the general tendencies that I've seen, but the answer for any one individual would be that individual would have to find out for themselves, right? And I'll talk a little bit about that. So first, kind of the basic answer in the general sense, the technical answer. Can somebody with a personality disorder be a counselor? Yes. And I actually know a number of people who have personality disorders who are counselors. Now, it's not always a good fit, and I'll talk about that, but this is something that does happen. The question, however, is not always can, of course. It's questions like, should somebody with a personality disorder be a counselor? What are the concerns, the risks? Is it good for the person with the disorder? Is it good for the clients? So to answer these questions, I really have to look at each of the 10 personality disorders, and I'm going to go through them really briefly and provide my thoughts about each one. Now, the 10 personality disorders are divided into clusters. Cluster A, B, and C. So I'm going to start with cluster A and move through cluster C. So cluster A is the odd eccentric cluster. We have paranoid, schizoid, and schizotypal. There are a number of factors with each of these disorders, and all the disorders I'll be talking about that could interfere, but I'm just going to look at a few. So with paranoid personality disorder, I think one of the problems here would be the level of trust for other people is very low, and sometimes counselors need to be trusting. And also, I think just in general, paranoia kind of interferes with someone's ability to be a counselor. With schizoid, we see here that somebody's asocial, not antisocial, but asocial, so they don't want to be around other people. They have no desire to be around other people. So I don't know necessarily how much the symptoms would interfere with the ability to be a counselor. I mean, they could, but I don't think somebody with schizoid personality disorder would generally be interested in counseling as a profession. Now, at schizotypal, we have somebody who has like odd beliefs and magical thinking. This is considered, like all of cluster A, to be on a continuum with schizophrenia. So this could be problematic in terms of some of the reality testing elements. So cluster A in general, we see there could be some difficulties. Cluster B is the dramatic, erratic, and emotional cluster, and here we see antisocial, narcissistic, borderline, histrionic personality disorders. So this is the one I think that gets the most attention. This is the cluster that gets the most attention. And even specifically looking at this question, I think this is the cluster that gets a lot of attention. So with antisocial, I think the elements that could get in the way would be a criminal history. So just logistically, it could be difficult to get through the educational process and to get licensed with a criminal history if someone has a criminal history. Not everybody with antisocial personality disorder would have a criminal history, of course. We also see the tendency to be irritable, aggressive, or deceitful. That could get in the way. If a counselor were to be irritable, angry, aggressive, and lying to a client, that would be problematic. Now, with narcissistic personality disorder, we see kind of a disorder of self-deception and lack of insight. Now, lack of insight, of course, characterizes all the personality disorders. But with NPD, we see someone who's arrogant, manipulative, they have a sense of entitlement, they're jealous, all characteristics that would interfere with a counselor-client relationship. Now, with borderline personality disorder, we see a lot of boundary crossing in relationships. We also see anger and emotional dysregulation, impulsivity. All these could be problematic. And the last cluster B personality disorder is histrionic. And here we see someone who's provocative and also would have boundary problems. So with cluster B, we really see a lot of potential barriers, just like we would see with cluster A. Now with cluster C, this is the anxious, fearful cluster. We see avoidant, dependent, and obsessive-compulsive personality disorders. Now that last one, obsessive-compulsive, is different than obsessive-compulsive disorder. So with avoidant personality disorder, we see that somebody here may actually do okay with counseling, but they may have a reduced interest in the field because being around people may be challenging. So avoidant is kind of an interesting personality disorder in that way. I don't necessarily see a lot of areas where it would directly interfere or make somebody like a dangerous counselor or anything. But I think somebody with that disorder, again, may not be interested in some of the associated aspects of the counseling profession. So one-on-one may be okay, but for example, they may not like to run groups. So with dependent personality disorder, I think the real problem here would be the trouble making decisions. And if the counselor wanted to use the client as an instrument of support, that would be problematic. So with obsessive-compulsive, here we see someone who's perfectionistic. They have kind of a driven personality. They're productive. They have a rigid view of like rules. I think here there's some barriers. Obviously, we have to be open to other people's thoughts as a counselor and their opinions and not always believe that we have the right answer. But with obsessive-compulsive, I think a number of people with this disorder could actually be good counselors, and I know a few counselors who have this disorder specifically. So I actually see kind of the fewest number of barriers with cluster C as compared to cluster A and cluster B personality disorders. So with all this in mind about the specific personality disorders, I think there's a few important things to point out here when answering this question. The first is that personality disorders tend to co-occur with other personality disorders and other mental disorders in general, like mental disorders related to depression, anxiety, or excessive use of substances. So the personality disorder itself may not be problematic in a given situation, but the comorbid conditions could be. For example, a counselor can't actively be using substances excessively and still be competent. Another thing to consider here is that becoming a counselor is not a method to treat a personality disorder or any mental disorder. And sometimes we see this. Sometimes we see that people are interested in the counseling profession because they have a mental disorder. Now, this is completely understandable, but becoming a counselor actually causes more stress and won't help somebody to gain insight or relief in terms of a mental disorder. It actually can lead to more problems. So there's a self-care component here. Now, another thing to keep in mind is there are severe repercussions for doing this job badly. So if somebody wants to be a counselor, but they're not really geared for it, they're not wired for it, or they're not in a place where they could do it at that moment, there could be innocent people that get hurt through bad counseling practice. So a person really needs to be ready before getting into this field. So with that in mind, what would somebody need to do if they had a personality disorder and they are interested in being a counselor? Well, I mentioned the self-care component. I think they would also need to seek counseling because personality disorders are considered relatively stable, so they'd have to work with a counselor and make sure they had control over the symptoms and they could be competent as a counselor. They would need to build insight. They would need to seek supervision and I think this is a good idea for anybody, regardless of the presence or absence of a mental disorder, and they'd have to be open to feedback, because lack of insight is a key part of a personality disorder. So if a supervisor gives feedback, an individual would have to be willing to say, okay, maybe that feedback is justified. Maybe there's something I can learn from that feedback. I think another idea would be to consider related helping fields. Being a counselor isn't the only way that somebody can help another person. Counselors help people with specific problems like mental health symptoms and reaching goals and moving through stages of development, but there's a lot of other areas where people need help. So if someone's interest is simply in helping other people, and counseling may not seem like a good option, there are a lot of other good options available. So I think with all this, my message would be, don't be discouraged. We live in an age of personality perfectionism, right, where we see like people want everyone's personality to kind of gravitate toward the mean. People don't like extreme personality traits. And I'm not really a supporter of this. I'm more of a supporter of the diversity that we see with personality. I don't think that pushing everyone to act the same actually helps society. And counselors are sampled from the population, and they have all the same problems that the population has. So we need representation in the counseling community. We need a lot of different personality characteristics in the community. But at the same time, we need to be realistic about managing personality factors that could influence the performance as a counselor or the performance in any type of job, right? Some personality types just aren't suited for certain types of work. So those are my thoughts on personality disorders and becoming a counselor. I know whenever I talk about issues like this, there are going to be people that have different opinions, people who agree or disagree with me, or who have other thoughts. Please put those opinions in the comments section. They always generate a really interesting dialogue. As always, I hope you found this description of personality disorders and counseling practice to be interesting. Thanks for watching.